Welcome to Infectious Conversations, the infectious diseases podcast recorded at WVU Medicine in Morgantown, West Virginia. And now your host, Dr. Mira Mehta.
Hello, everyone, and welcome to this month's episode of Infectious Conversations. This is WVU Medicine's Infectious Diseases podcast, and I'm your host, Dr. Mira Mehta. I've been a clinical infectious diseases pharmacist at Ruby Memorial Hospital for about 8 years now. We have a very great guest with us today, Amy Spiegelmeier. Amy, if you want to introduce yourself.
Yeah, thanks for the intro, Mira. My name is Amy Spiegelmeier, and I'm a clinical infectious diseases pharmacist at WVU Medicine, WVU Hospitals, and I've been here for about 4 years. So glad to be here and join you today.
Yeah, thanks for being on the show. So today we're going to be talking about the role of an infectious diseases pharmacist. And I'm not sure if everybody knows what an infectious diseases pharmacist does in the hospital setting. So I thought today would be a great episode to shed some more light on that. Amy, do you want to start with what do you do in your current role here?
Yeah, well, what I tell everyone I do is give unsolicited advice for a profession, since whenever you say you're an ID pharmacist, people look at you like they have no idea what you're talking about. But in my role as an ID pharmacist, I rotate through 3 different positions: antimicrobial stewardship, OPAT, which is outpatient parenteral antimicrobial therapy, and COPAT, so complex outpatient oral antimicrobial therapy. In the stewardship role, which is kind of where I spend a little bit more time, we try to optimize patients' antimicrobial regimens, and so we want to make sure that patients are getting the right antimicrobial agent at the right dose for the right bug, and it's appropriate for the patient. So just trying to truly optimize therapy and make sure that our patients have the best outcomes possible.
Right, because without that, there's a lot of antimicrobial resistance, or there could be a lot of inappropriate prescribing of antimicrobials as well. So it's pretty important to make sure that there's someone to ensure that there's judicious use of the antimicrobials.
Yeah, I mean, that's actually one of the reasons why I really wanted to be an ID pharmacist, is because, every pharmacist out there has a great role and an importance to healthcare. But I think ID specifically is a really interesting area where you can have an impact not only on the patient that's being treated, but the hospital in general, the region, and so many more patients, since antimicrobial resistance is something that can impact everyone.
Definitely. Absolutely. And then you talked about OPAT and COPAT, if you want to shed some light on that as well.
Yeah, absolutely. So, OPAT is essentially a program that ensures patients leave the hospital on intravenous antimicrobial therapy safely. And so we'll watch patients from the time of their hospital admission through the discharge process. And so we ensure all transitions of care go smoothly, especially since this is an area where sometimes things can fall through the cracks. And so we want to make sure that nothing is missed at that point in time. And then we also follow them all the way through the end of their therapy, monitoring labs, adjusting medications as appropriate, collaborating with our infectious diseases physician colleagues, or APPs, all the way through the end of therapy when they can have their central access removed. And COPAT is very similar, but with oral agents. And so once again, following them from admission through the discharge process to the end of their therapy, once again, making sure that they receive appropriate therapy that is safe for the patient.
And you recently took on a new stewardship role. Why don't you tell us a little bit about that?
Yeah, absolutely. So I'm the co-chair of the WVU Hospital's Antimicrobial Stewardship Committee. And so in this role, I collaborate with our infectious diseases physician lead. We discuss potential initiatives for our hospital. We have quarterly meetings with some of our colleagues from a bunch of different specialties, essentially making sure that everyone's on the same page with antimicrobial stewardship, because our efforts really take the entire hospital being on board to make sure things are done appropriately. There's a few other things that we do as well, though. Obviously, working and collaborating with others is important in all the initiatives that we start, but we also do some antimicrobial tracking. So we track days of therapy, or we say DOT, and then we also track SAR data. So that's a standardized antimicrobial administration ratio, and that essentially compares our antimicrobial utilization to what is expected of a hospital hospital of our size. And so these are some metrics that can kind of be tracked from year to year to show the impact of our initiatives, and then also see how we shape up versus other hospitals or what's expected of us, to kind of give us an overarching perspective of kind of how we're doing as a hospital. And so I'm really excited to kind of jump into that area of my expertise.
Yeah, definitely. I've been present at your antimicrobial stewardship meetings and seen firsthand you guys are doing a lot of great things there. So we appreciate everything you all are doing there. A little bit about myself. So I am an infectious diseases specialist as well. And I also go through the same roles that Amy does. So I do rotate through antimicrobial stewardship, OPAT, and COPAT. I actually did help to create the OPAT program. As Amy mentioned, we closely monitor patients discharged on IV antimicrobial therapy. I will say our OPAT program at WVU Medicine is very, very robust. We follow all patients no matter where they're discharged to, and we make sure that we keep a very close eye on them. And as Amy mentioned, we live in a very rural area, so it can be quite challenging. Our patients, they may live very, very far away. They might not have adequate resources. Some patients don't have running water or electricity. And so we do have to make sure that we do a very thorough job in coordinating care, making sure that those patients get the care that they need and that we're providing close follow-up for them. So that's definitely a part of my position that I actually enjoy. And since we're talking about what an ID pharmacist's role is, that's an example of one of them too, is that an ID pharmacist can help create new programs like an OPAT program, like a monitoring program to monitor outpatients. So it's very versatile as to what we do. I also play a role in the COPAT area as well. I recently became a director of the PGY2 Infectious Diseases Residency Program. So that's another role that I have, and as an ID pharmacist. So I have my own residency program where each year we will train one infectious diseases resident, and they will do rotations and train to become an infectious diseases specialist. And I absolutely love that role. It's actually where I started. So when I started my infectious diseases career, I trained here at WVU at Ruby as a resident myself, and now we've gone full circle and I've actually become the director of the program that I trained in. So that was really exciting for me, and I really, really enjoy that role to help train and shape and encourage and inspire and be a mentor for our pharmacy residents, or just residents in general who have an interest in infectious diseases. We do also train residents and students as well. So we teach them about infectious diseases. We supervise them while they're on rotation. We're very involved in their learning and development to become practitioners and to become clinical professionals. We also are involved in research as well. So, Amy, you've had a few publications published in peer-reviewed journal articles, and I have as well. If you guys ever want to check those out, I'm putting in a plug for our articles that we wrote. But what have your publications been on?
Yeah, I mean, the most recent one was actually stemming from my second-year residency training. We actually looked at antimicrobial appropriateness at hospital discharge. So, a lot of our stewardship efforts are targeted towards the inpatient setting, so trying to make sure patients are getting appropriate therapy. But what we've noticed is that sometimes when the patient goes to get discharged, maybe the antimicrobial therapy isn't continued as originally intended. Mm-hmm. So maybe they restart the duration of 14 days on discharge, or maybe they get the dose wrong for the patient's renal function. And so the publication was actually looking at the impact of having a pharmacist involved in the discharge reconciliation process and how that would impact appropriateness. And essentially, we found that when a pharmacist was involved, the appropriateness of prescriptions went up, a pretty statistically significant result as well. And so just another area where pharmacists can be heavily involved and impact patient care. And they didn't even have to be ID trained in this specific study. And so just kind of goes to show, once again, another opportunity for us to kind of get involved.
Yeah, it's really interesting because we're like a network of pharmacists, and the physician we work with, Dr. Johnson, she mentioned this the other day, is that there's so many pharmacists that work within the hospital, and we're all connected with each other. We all have different specialties. We know how to talk to each other and find each other. Like if I have a patient who's also an oncology patient, I'm not the oncology expert, but I know who to reach out to from the pharmacy side. And so we're like this intricate network throughout the hospital. And I really enjoy just having that support from pharmacists in other specialties as well throughout the hospital.
Yeah, I mean, I don't think we could do our job without them. And even other providers as well. I mean, we really rely on the collaboration. I think that's kind of what makes our patient care exceptional. And definitely one of the my favorite areas of kind of what we do day to day. But I think, you talked about all of these different areas of expertise. We do stewardship, COPAT, OPAT, you're the PGY2 RPD with regards to, academia and residency. What's your favorite perspective or aspect of your job?
It's hard to pick just one. It really is hard to pick just one. I think one of my favorite things is infectious diseases is so dynamic. Sometimes we get really difficult cases to deal with where the treatment options, they're not quite straightforward. Sometimes patients may have complications or allergies or other things going on, or maybe they may have failed first-line therapy, where now we got to think outside the box and create a new treatment plan or regimen, and there might be very little data behind it. And so I really just love working within multidisciplinary teams to help come up with these plans to then help treat the patients, but then follow them closely just so that we know how they're doing. And if they're doing well, that's great. If they might be having issues or problems, we can closely follow up on them and talk to them and pivot on that treatment plan to make sure that we have the best outcome possible. And I think I really enjoy that aspect as well.
Yeah, I think I can definitely echo that. Even going back to when I chose to become an ID pharmacist, I feel like I loved how kind of dynamic and gray ID can be. Yeah. There can be so many correct answers, and sometimes there can be none. Yeah. And so we really have to be creative to kind of come up with these treatment plans. And so
definitely. I also love being a drug expert as well, because as a pharmacist, we really know about dosing, we know about pharmacokinetics, how different drugs affect the body, how different enzymes that people may have affect those antibiotics. And so sometimes the dose that you might give one patient might not be the same dose you would give in another patient, or their body is going to metabolize the drug maybe a little bit differently than another patient. And so I love knowing and being an expert in that information, because it definitely can help the other team members where dosing might not be their specialty in general. Yeah,
I definitely think that that's an area where we commonly add to recommendations for our patients.
Yeah, for sure. Teaching is another thing that we do. So we both actually have a lecture we're teaching tomorrow, but we both do didactic lectures at the pharmacy school as well. And another role that I have is I'm actually on the BCIDP Specialty Council. So essentially there is a board exam for pharmacists that infectious diseases can take. It's an infectious diseases specialty certification. And I'm actually on the specialty council for that. So I have colleagues throughout the nation that I meet with. Actually, one of them is international as well. But we meet periodically to discuss that exam. And so there are other roles you can have on a national level. Some of our research, we've taken that nationally and internationally. So some of my research I've actually been able to present in Amsterdam in the Netherlands, and then more recently Copenhagen in Denmark. So it's really cool to bring WVU Medicine's name out there on an international level. And I've actually been able to talk about our OPAT program in Cape Town, South Africa as well. So many cool opportunities from being an infectious disease pharmacist, for sure.
Yeah, I would say so. I mean, I think if our listeners get anything from this podcast, it's that the opportunities for an ID pharmacist are really endless.
Yeah.
And so we don't even know what's coming next.
Yeah. So, Amy, can you talk a little bit more about what it took to become an ID pharmacist and to be in your current role.
Yeah, so after 4 years of postgraduate training in pharmacy school, I did 2 years of postgraduate residency training. I did my first year in Philadelphia and then my second year here at WVU Medicine. After completion of my PGY2, I got a job and I took the board certification test that you're referring to. So I am BCIDP certified. And so really, it took my pharmacy school education plus an additional 2 years. But I think kind of on top of that is just that I've learned so much in the, 3+ years since I finished residency that really helped me perform my job to the best of my abilities, each and every day. And I know there are different pathways for other individuals as well. I know some people get into infectious diseases without even doing residency training and even do different certification programs, throughout their job as well.
Yeah. Yeah, and I followed a similar route. Actually did work in hospital pharmacy prior to that, but then I decided to go back and do an infectious diseases residency, and I've been here ever since. I've loved it ever since and stayed here at WVU Medicine ever since. So, Amy, do you have any final thoughts about being an ID pharmacist?
I think, in general, if anyone can take anything away, it would just be that for infectious diseases and as a whole, we would kind of need everyone to be involved in our efforts. ID pharmacists are a huge part of that, and that the opportunities are really endless, and it's a great area of practice to get into.
Yeah, it's really, really fascinating, just the infectious organisms as well. How they can become resistant, how they have virulence factors as well. They try to evade the immune system, evade antibiotics. It's just a very fascinating area to work in, and we're really happy to help, whether it be helping our patients, helping our physician colleagues, our nurses. We're really happy to be within multidisciplinary teams and put the patient at the center whenever we come up with our treatment plans. And so we're just always here to help. Well, thank you, Amy. I really appreciate you being on the show today and shedding some more light into what we do. I am your host, Dr. Mira Mehta. I hope that you tune in next time. And this was our special guest, Amy Spiegelmeier. So we hope to see you again on our next episode of Infectious Conversations.
Thank you.